You're listening to Fast Facts, Ask the Expert with Machell Hudson-Hoover.
Hello, everyone. It is January, and this is the month of opportunities to better care for our health. Our professional goals are set, and what we also know is sadly, by the end of January, most Americans have already quit. By the end of the year, only 9% are actually going to reach their goals. So, what this next year is going to be about is really going to be about learning what it means to be healthier. This is where we will build better clarity, not only when educating and creating patient personalized plans for our patients, but this will help each of us better care for our own health as well. And I'm going to be cheesy, but I believe it with everything in me. When we are healthier, we get to love our patients better, our family, and our friends better. So let's begin this year by kicking off having a better understanding of what the oral gut microbiome is. So what is the oral to gut microbiome? So we know oral microbiome is a complex network of microorganisms, including bacteria, fungi, viruses that exist in the oral cavity. But guess what? This can extend through the entire digestive system. The oral cavity is the GI's tract entry point. So that saying that the mouth is a gateway to health or disease could not be any more true. Influencing the gut's microbial environment, it absolutely does. And so I encourage you to share that with each and every one of your patients and your family. The role in whole body health. So we know that a balanced microbiome is going to help prevent systemic inflammation, and it will support healthy digestion. We know that dysbiosis, which is a microbial imbalance in the oral cavity, is going to potentially contribute to conditions such as periodontal disease, caries disease, and systemic diseases like cardiovascular disease, diabetes, other metabolic conditions, and GI disorders, and so much more. So a minute on bi-directional relationship. We know that poor oral health can influence gut health by introducing pathogenic bacteria. For example, research has shown that gut dysbiosis, such as IBS, irritable bowel syndrome, can now be connected to patients with active periodontal disease. Periopathogens such as P. gingivalis, F. nucleatum have been researched as root cause. And we can discuss this on a later podcast if you would like. Just let Andrew or myself know. We know that GI health impacts oral health through systemic inflammation and nutrient absorption as well. So why the oral gut microbiome matters? Well, if what you've already heard isn't enough, we know that it maintains a robust immune system by modulating inflammatory responses. We know that it plays a critical role in nutrient metabolism and absorption. It is going to influence systemic conditions such as autoimmune diseases, metabolic disorders. We know obesity, there's a connection between obesity, periodontal disease. Where do we start? So this is the call to action per se. So let's reflect on the oral health, digestive health connection. So what I want you to do is I want you to think about your patients when they sit in your chair. And this is really going to start with the health history. How might your patient's untreated oral conditions such as periodontal or caries disease affect their digestive health? And what we can do to act is prioritize oral hygiene practices, such as those traditional practices that we've been educating for so many years, electric toothbrushes, interproximal cleaning, using pH balancing oral products, xylitol. But what we get to start talking about, which really takes us to the next level in our healthcare practice, instilling greater value between us and our patients, is lifestyle habits like healthy diet, rich in pre and probiotics, healthy sleep, stress, further can help improve oral and systemic health. And we get to collaborate with, first, we have to be able to collaborate with our team. Second, we get to collaborate with our patients. And then third, and the most enriching, is when we really get to start collaborating with medicine, which truly brings the most elevated care for our patients. I hope you enjoyed this podcast. Have a blessed week and the rest of your month.
You can reach out to me, Machell, at rdhhealth. You can also find me on LinkedIn, Instagram, and Facebook, Machell Hudson-Hoover.
And I hope all of you achieve your goals this year.
Thank you for listening to Fast Facts Ask the Expert. If you have a topic you'd like one of our experts to answer, simply email me, Andrew, at ataleoftwohygienist.com, and we will get it on the air as soon as possible. Thanks for listening.